National President, National Association of Nigerian Nurses and Midwives.
Sir,
Give us the highlight of this event today. This week actually is a week for our NEC meeting, National Executive Council, the National Association of Nigerian Nurses and Midwives. We have started the meeting yesterday, and today continues, but precisely for today, we fixed the day for training, which will continue tomorrow. The training has to do with automated management registration of our members. So we are here to learn the application so that it will be part and parcel of us. So that even when we engage other members, we'll be able to guide them effectively so that they can do the registration online and on their own.
okay. Can you just give us the update concerning the new portal that is ongoing now in the union?
Yeah, the new portal is actually meant to streamline and centralize all that has to do with our membership registration. So everything will now be done online so that it will be seamless. And then of course the use of paper will be less, much less. And it will please you to know that for the past 8 years, even our election has been online. We do e-voting. In fact, when I met, it was e-voting. And even in subsequent national delegate conference, we intend to use it.
How do you get to do this e-voting?
Well, if you know in today's environment, you will notice that science and technology is almost taking shape of everything. And the nurses and midwives are very sensitive about changes in technology and advances in medical practice. So as a result of that, we have key into innovations of trying to become technologically compliant so that anything that has to do with computer science and technology are carried along and be more effective in issues. Because even in medical practice, there are a lot of introductions that require that you don't need to stand where you are. You need to advance as the world is changing.
So as a president of this union, so can you just tell us some of the things you have done to move the union progressively forward, sir?
Thank you so much. You know, everything about union has to do with welfare of members. And we have been very sensitive about the welfare of members. Unfortunately, I won't tell you that it has been rosy. The reason is that nurses and midwives work under stringent conditions, stressful conditions, in such a manner that there is a high workload on the nurses. The environment is not decent. Coupled with the challenges of a lot of people moving because of search of greener pasture, because the nurses and midwives are actually not adequately compensated, and that has given rise to a lot of people moving out in search of greener pasture. And that is why even in our meeting yesterday, we addressed the issue of government improving our welfare package through giving us enhanced nurses salary structure. We are strongly asking for an enhanced salary structure, which should be restricted to nurses and midwives. And collectively, I agree that if government is able to give us that, then the issue of JAPA as life will reduce to the barest minimum. Welfare has become uppermost in the life of any civil servant.
So what would Nigeria expect from your union now that you are setting up this new agenda for ensuring that we have e-platforms to move the union forward? What would Nigeria expect, sir?
What we are doing actually will definitely impact positively. Our concern is patient satisfaction. That patient satisfaction, you never know who will be that patient. And what we want to do is that we want to ensure that every patient that comes to the hospital goes quite improved. We want to have better patient outcome and satisfaction. By what we are being exposed now, yes, assuming we don't have enough nurses, if you use laptop, you can key in data that will be able to reflect the vital parameters of 80 patients. Unlike having 2 to 60 patients in the ward, effectiveness may not likely be there. So it is expected that this training will improve our performance in a clinical setting. So definitely, patients will benefit, Nigeria will benefit, and of course, by the time we achieve what we are here to do, we'll be able to confidently say this is the number of nurses and midwives we have, and it will help in planning, both for us as a union, association, and both for government. So data is very important in any human endeavor.
Thank you.